Good morning, everyone, and thank you for attending the Northshore University Health System virtual job fair event. Excuse me, my apologies, folks. I would like to introduce you to the Northshore team. They're going to tell you a little bit about their company, job openings that they do have, and how to apply for those openings. Just as an FYI as well, we are going to have a breakout room session immediately following the employer presentation. So in that session, you will have an opportunity to meet with the folks that are on the call today from Northshore University. There's going to be 4 breakout rooms that you'll be able to join. One will be medical group offices. The next will be the hospital. Next will be hospital nursing units. And last but not least, we'll have laboratory services on the line too. So if there's any positions that fall kind of under the umbrella of any of those sectors, if you will, that I just mentioned, please plan to stay on the line and meet with those folks after the presentation. So without further ado, I'm going to hand things off to Northshore. I do believe Donna or Dana, are you available to present? Or any other available member of the Northshore team? And not sure if we're having some technical difficulties, but if somebody from the Northshore team would like to go ahead and again begin the presentation, please feel free to do so.
Daniel, I believe Donna's having audio difficulties. Do you mind giving her 1 minute?
Yeah, absolutely. I'll go ahead and see if I can troubleshoot that here as well. My apologies, folks. Give us just 1 moment.
We appreciate everyone's patience. Thank you.
And Donna, just an FYI, if you are joining by telephone, again, you'll want to be sure to press *6 to unmute yourself. Just an FYI.
Can you guys hear me?
Yes, I can. You are all set. You should be able to present now.
All right, great. Thanks, everybody, for your patience. Welcome. We are super honored to be able to meet with you all today. We have a short presentation, and it's only meant to, to provide a brief overview of our organization. And at the end, we will share our career site information so you can browse all of our job opportunities and apply online. Next slide.
Great.
So who's Northshore? Northshore is a growing organization that's committed to being connected to the communities we serve, having experts close to home, and being one of the top places to work in the healthcare. Next slide. The map here displays our geographic reach from as far north as Gurnee, Illinois, which is by Great America. Usually everybody knows where that is. And as far south as Chicago and western suburbs of Arlington Heights, Naperville, Elmhurst, and many suburbs surrounding the hospitals. Next slide. My previous slide talks about the 5 specialty institutes where Northshore has been recognized as a premier place to receive care for orthopedics, cardiovascular, cancer care, neurology, and the Center for Personalized Medicine. Our future growth in establishing additional specialty recognition is ongoing and very important part of our future in delivering elite patient care. Next slide. This slide talks about many things, but I want to focus on the green box that highlights the number of employees that work at Northshore. We are proud to say we are comprised of 17,000 employees, and we continuously grow our teams as our companies continue to serve and expanding its geographic area. Next slide. Now that we have the basics of who we are out of the way, let's focus on our mission and values. Our mission is to preserve and improve human life. Our vision, North Shore will be the most trusted and indispensable health partner throughout the communities we serve. Our guiding principles: excellence, accessibility, value, indispensable, ownership. Next slide. North Shore has received many awards and recognitions. This slide shares awards for our quality and safety, patient care, and technology and innovation and engagement. We're super proud of these accomplishments and strive to maintain the high standards we set for ourselves to better serve our patients. Next slide. Next, we will talk about what makes us different. Next slide, please. This slide represents our two hospitals that are partners of Northshore University Health System. While they work closely with us to align patient services and share our core values, they work separately with recruiting and hiring. Next slide, please. We are proud to be part of the Pritzker School of Medicine. Medical students rotate through our hospitals as part of their residency training. Our orthopedic surgeons are primary caregivers for the Chicago Blackhawks and serve on the sidelines of their home games in the event of an injury. The other companies partner with us for various services. Next slide, please. This is another example how North Shore is committed to helping train the next generation of healthcare providers. This list identifies all the colleges, training programs that have relationships with us and/or have clinical rotation partnerships for their students. Next slide. As our organization has grown in the last 2 years, we use the Stronger Together tagline to describe our strength as an organization when we have our other hospitals join our health system. Swedish and Northwest Community were standalone hospitals, and now we're partnered with us. January 1st of this year, Edward Elmhurst Health joined Northshore University, and we're now comprised of 8 hospitals and 1 skilled care facility for a total of 9 premier locations where community health members can receive care. Next slide. So diversity, equity, and inclusion are a very important part of our culture here at North Shore. We value the diverse backgrounds of all of our employees. Next slide. And we have a huge priority in deepening the connections to our local communities we serve. Next slide, please. So we are constantly moving forward, and our commitment to providing expert care close to home and being the best place to work and receive care is always at the forefront. Next slide, please. Now to the good part. North Shore offers a robust benefits package for employees. We offer health, vision, dental, and competitive wages, tuition reimbursement up to $5,000 for full-time, retirement, 403B savings, paid time off, and much more. Next slide, please. The recruiters at this event are here to discuss a variety of opportunities in the hospital setting. It's our medical group, lab services, and pharmacy. Some of the positions we're hiring for are outlined here: patient care tech, staff support tech, medical assistants, pharmacy techs, phlebotomists, and lab assistants. Next slide. We look forward to meeting with you. Job-specific questions can be answered in our individual meeting rooms. Thank you.
Excellent. Thank you so much for that presentation. And again, we're going to go ahead and delve right into the breakout rooms portion of the event here. Of course, we want to set aside an adequate amount of time for you folks to be able to meet with the North Shore team. So we're going to delve right in here to the breakout room kind of setup, if you will, here, just to give you all folks a little bit more familiarity with how this process is going to work. So again, if you are having issues joining a breakout room, it could be that you are running an outdated version of Zoom Client for Meetings. Again, you can download the most recent version of that at zoom.us/download. Again, if you're having trouble joining a room, moving freely from room to room, so on and so forth, this could be one of the issues that you are experiencing. If for whatever reason you need to hop off the webinar to download that, feel free to do so. I'll be monitoring the waiting room. So if you do have to hop off to download that, again, I'll let you right back in. So just please be aware of that. Next, joining a breakout room session here, you'll see we've got a slide up on screen with a few screenshots that I took just to kind of familiarize you with how to join a breakout room. You'll see the first screenshot there is a screenshot of the Zoom toolbar. So when I open up those breakout rooms, if you are joining via laptop or desktop, you will see an icon similar to the one that you see on screen right now in the red square. What you'll go ahead and do to join a breakout room is click that breakout room's icon. What it will then do is open up the second screenshot that you see here, which will just be a window of all the rooms that we have available for you to join. As you'll see off to the right-hand side with the red circle there, all you'll go ahead and do is click join for whatever room it is that you would like to go ahead and join. One quick note that I want to go ahead and make is if you are joining via mobile device, so tablet, phone, something similar, you may not see this exact format or setup, if you will. If you, again, are joining via one of those mobile devices, you may have to click the More tab. So you'll see in this screenshot, you'll see up to the right-hand side of the Breakout Rooms tab, there's a More option. You should have something similar on your mobile device as well. If you click that, a drop-down menu will open up, and there will be an option to join breakout rooms. You'll click on that, and that second window that you see on the screen will open up, and it will be the same process that you'll go about using to join a room. So again, you'll just click join for whatever room you'd like to do, and then you'll rinse and repeat. So what I mean by that is, again, you'll click on the breakout rooms icon, it'll open up that window, and then you'll click you'll click join for the next room that you'd like to join. Again, you'll just repeat that process. Now, real quickly here, I want to go ahead and let you folks know what rooms we do have available once more, because I know we had quite a few new folks join. We have medical group offices, we have hospital nursing units, and laboratory services. And I will put this slide back up on screen here once we begin for you folks to be able to reference. So you'll see here just a brief overview of what to expect as far as the session is concerned. Again, we'll have an employer rep in each room you'll see there. The session will be 45 minutes. And you'll see there, you will have the ability to move freely throughout all of the rooms that are available. And then once you join the room, you will be able to unmute yourself. Once you've entered that room, you'll also be able to turn on your camera if you would like as well. And then last but not least here, just a few ground rules that I always like to cover. Again, please just be aware of the time that you're taking to ask a question. Just be mindful of that. Obviously, you're going to have other job seekers in the room asking questions as well. So just be mindful of that. Again, you are more than welcome to share your video and camera and also unmute yourself, but just please be mindful, keep things respectful, courteous, and professional. Again, you'll see there, if you do not abide by those rules and opt to be inconsiderate or disruptive for whatever reason, we can go ahead and place you permanently on mute. Before we do so, you will receive one verbal warning. And then if you do disregard that, you will be permanently placed on mute. And then the last point that I'd just like to cover real briefly here is if you are permanently placed on mute, you'll still be able to stay in the session, but you'll only be able to ask questions through the chat feature. And unfortunately, if you do opt to use the chat feature to cause further disruption, we will have the ability to eject you from the session if need be, and you will not be permitted re-entry. Again, we typically don't have any issues with this, but just want to make you folks aware that we do have a process for that if need be. So I'm going to navigate back to our slide here for you to reference. Again, want to let you folks know there's going to be 45 minutes in the session. You will see a timer in each room up in the right-hand corner that'll tell you how much time is left in each session. Once we reach that 45th minute, there will be a 1-minute countdown timer. So if you are in the midst of a conversation with somebody at that point, that will just kind of be your cue that it's kind of time to begin wrapping things up before we come back to the main session here. One other thing that I do want to note is that if you are, for whatever reason, experiencing difficulties joining a room, not able to join a room, just let me know through the chat feature. Drop me a message which room it is that you would like to join, and I can manually send you to that room. So again, just use the chat feature in Zoom. Let me know which of the 4 rooms you'd like to meet or join, excuse me, and I will get you sent to that room. Again, for the last time, we have the medical group offices for North Shore on the line. We've got hospital on the line, hospital nursing units, and laboratory services on the line. So I'm going to go ahead and open up these rooms now. And once I do, you'll be able to immediately begin joining those rooms. Have a great event, everybody.
Hello.
Hi there, how can I help you today?
Hi, Mr. Daniel. So none of these opportunities are for the South Suburb area.
That I'm not 100% sure of. Just give me a moment. Sorry about that.
I can answer that. No, most of the locations are in the north side. The closest probably will be near downtown, uptown area, but no, unfortunately, no.
Okay. Thank
If
you
you
so
are
much.
looking for opportunities in the south side, please send me an email and I'll see how we can connect you with other employers as well.
Okay. So Ms. Maria, what's your email?
Okay, I'm gonna put my email in the chat box, okay?
Okay, I'm gonna send you an email right away. Thank you so much again.
I have a question. Hello.
Yes, how can we help you?
Hi, yes. So do y'all hire felons?
I can barely hear you. Can you,
Do you guys hire felons?
do they hire what? I'm sorry.
Felons.
You will have to join one of the rooms and ask that question to the recruiters.
Okay. Okay, thank you.
If you scroll down in the list, you'll see the group name. I mean the room names. You can join and ask.
I'm gonna have to log out instead of log back in because it's not giving me that on my screen at all. So I will exit out and then log back in so he can log me back in and go and upgrade it.
And also, if you check the chat box, I entered my email address there. If there's additional questions that you want to ask after the event, go ahead and reach out, okay?
Okay, thank you.
Okay, thank you so much for that, Maria. We had quite a bit of background noise there on that one, so apologies, folks. Again, you'll see in the chat that I threw a message there for you. I'll go ahead and put it here again. Just give me one moment, please, folks. I'm going to go ahead and throw another message here in the chat for you. You'll see the 4 rooms that we have open and available for you to meet. If you're still having issues joining a room, just let me know where you'd like to be sent, and I will get you sent there. Just let me know, okay?
Hello.
Hi there, how can I help you?
Hello, can you hear me?
I can, how can I help
Yeah,
you?
thank you. I would like to ask about the medical assistant job. So which breakout room I joined?
I do believe that would more than likely
You
probably be
can join
medical
the
group.
medical group offices.
Yes, thank you so much. And I have another question is that because I am a international medical graduate, I'm a physician from Vietnam, and I just got a letter to authorization from the Illinois Professional Regulation Department to authorize me to provide the treatment and care for the COVID-19 patient in Illinois state. So I'm wondering that in Northshore University Hospital, you need any job for that? It means that I will be working under a supervision of a US doctor.
I will say join one of the rooms so you can ask that question directly to one of the recruiters. They will be able to provide you more information about it.
Thank you so much. And can you, how can I join the medical group office?
I'm gonna go ahead and send you to that room, okay? You'll have to be sure to accept the prompt though, once I add you to that room, okay?
Yeah, thank you so much.
Mm-hmm. And seeing folks still in the chat asking me to connect them, please just let me know who you'd like to meet with and I'll get you sent there.
Hi, I have a question.
Hi there, how can we help you?
For the patient care technician, what room would that one be held in?
I'm thinking it would, go ahead, Maria.
Yeah, you can go to any of the rooms, the medical group. No, actually the hospital nursing units or hospital.
Okay, can I get that link to which room that is?
And I will go ahead and
Or is
send you
that what
to
I'm
the
looking at on
hospital
the
room.
screen?
Yep, I'll go ahead and get you sent to the
Oh.
room, okay?
All right,
Give me
thank you.
yeah, no problem. Give me just one moment. All right, you'll want to be sure to accept that prompt.
I see it, thank you.
Yep, no worries.
Job seekers, if you are still in the main room, do not miss the opportunity to talk to recruiters. If you don't know how to join, let us know. Unmute yourselves. Let us know so we can assign you to the room.
Medical group offers hospital, nursing unit.
Is there a particular room out of those that you'd like to meet with first? And it looks like he already joined Maria, so we should be all set there. And again, just throwing that message into the chat. If you are still uncertain which rooms are available, I've thrown those into the chat. So just let me know which one you'd like to be sent to, and I will get you sent there. Thank you.
Hello.
Yes, how can we help you?
Hi. I was wondering if there was any point of contact person for this event. I mean, I think it's really great. I think it's a great opportunity, but in my opinion, it's a little chaotic. I don't really see how I can maneuver through this and meet with recruiters that like it's a lot going on. And I rather perhaps just have someone that I can email or just a listing of the openings that I can apply for and then just like follow up with someone perhaps.
When you register for the event, all the information about the hospital, it's included. Northshore Health System, of course, you can go to careers, to their website and see careers and check all the job opportunities. You can also, and of course, you can apply on your own, but you can also reach out to me. My name is in the chat box, and I will be able to assess and probably direct you in a better way if you are having issues with technology here. I mean, the rooms are, it's very clear, and it's actually 4 breakout rooms, so you should have no problem joining one of the rooms and talking to the recruiters. But if you are not able to do so,
I mean,
you can assign yourself.
It's not the technology, I believe. Is it Daniel put me already in a breakout room, but I mean, just how it's being ran. Everyone has questions. The hosts are being kicked off. There are questions in the chat that aren't being answered because people are just, kind of hopping on randomly with questions, not really kind of going in order. Like I said, I appreciate the opportunity. While
Okay.
I had good intention.
My email is included in the chat box. If you want to reach out to me, we can have a conversation later on, if you will.
Okay. One of the breakout rooms was hospitals. What does that entail exactly? Like what about the hospital?
Well, we do not represent the company, so definitely you will have to join and ask. I assume it's all the positions related to the six hospitals that are part of this network, and positions in general for them.
Okay. All right. Thank you.
Hello. Hello, Daniel.
Hello, how can I help you?
Hey, Daniel, I was in the wrong room. She said that was for hospital. I'm looking
Okay.
for pharmacy tech. I mean, not pharmacy tech, patient care, I'm sorry.
Okay, let me see here. So we have medical group offices. I don't think that would be the one you're looking for. We have hospital nursing units, and laboratory services. So you were in hospital, correct?
Yeah, so it might be hospital nursing unit.
Yeah, I'd say let's give that one a shot. If you're still having an issue, come back in and I'll get you sent to the next place, okay?
Okay, thank you.
Of course. And I sent that over, so just be sure to accept.
All right.
This meeting is being recorded.
hear anything. Don't hear anything.
Okay, it looks like we have a majority of the folks that are still in the session back in the main room here from the breakout room. So, of course, we hope that the breakout room sessions were fruitful for you, that you were able to connect with the employer reps that were on the line and get your questions answered, and hopefully forge some connections that will allow you to hopefully gain at least a little bit of a competitive edge in that application process. Before we kind of go through the official closeout here, Maria, is there anything else that you'd like to add for the job seekers on the line as far as, resources that are available through, the various workforce centers and what have you?
Yeah, I just wanted to add that for all the job seekers interested in learning more about the funded programs to help you with employment and even training, you can send me an email. We can share information about all the American Job Centers in the Cook County network where you can attend an orientation to learn more about the programs. So moving forward, if you have been looking for jobs for a while with no success, you will be assigned counselors, career coaches, employment team that we can help you and guide you and match you with the best opportunities available. If you're interested in healthcare jobs and you feel that you are not able to qualify at this moment based on the position of interest, there's trainings available where you can become certified. So there's a lot of information and opportunities that you may be missing by not being part of workforce programs. And also, if you are not, let's say, for example, you joined today, you don't have a resume, you don't know how to complete your applications or you need additional information, we can guide you as well. So feel free to reach out. My information is in the chat box. And also I included a link where you can start by completing a pre-screening questionnaire and we can take it from there.
Are you Maria Romero?
I am Maria here, yes.
Well, hello, Maria. My name is Miss Deneen Moore, and I sent resumes to your email as you requested in the email from Illinois Job Link. So I did send those. So if there's any qualifications,
I'll look for it and I can connect with you later on, and then we can take it. We can assess your job interest and provide you with the best guidance possible to refer you to either another center or just connect you with the employers.
Yeah, yeah. Well, the resume would be a good start, for you to have an idea of what my experiences and skills are.
Yeah, definitely. I'll go over it and we can have a conversation later on.
Thank you.
You're welcome.
Fantastic. Well, thank you so much for that information, Maria. Again, much appreciated. And again, if you're looking for that information that Maria just covered here, please take a look at the chat. You'll see the various links that she did reference, and you'll also see Maria's contact information there as well. So please take a look at that chat before we close out the session. Again, jot that down if need be. And then I also know as well that we have collected all of your contact information through the registration process. So I do believe folks from our workforce agencies will be following up with you post-event as well. A few more things that I want to note here before we wrap things up. I have recorded today's session, so I will be uploading it to the Illinois WorkNet YouTube channel within 48 hours. And that will be housed under the virtual job fairs playlist. So if you go on YouTube, just Google or just enter, into the search field, Illinois WorkNet, select the virtual job fairs playlist, and you will see the recording for this event there again within 48 hours time. And as I just stated, we have, through that registration process that you filled out information for, collected all that information. We will be forwarding that on not only to our workforce partners, but to Northshore University Health System as well. With that stated, I do want to give Northshore an opportunity. Do you folks have any sort of concluding remarks, summary statements that you'd like to make? If not, we can go ahead and close things out. But again, want to let you folks have an opportunity to do so if you'd like.
Thank you very much, sir.
And it does not seem that that's the case. So we're going to go ahead and close things out. We hope that you all have a wonderful rest of your day. Take care, everybody.
Same